Study another important topic which is adrenocortical disease. So let's start. Bismillah Rahman Rahim. So in this we'll start Addison's disease. Addison's disease is due to basically when you have atrophy of the adrenal cortex and failure of secretion of cortisol and aldosterone. Basically there's a decrease or deficiency of corticosteroids. Basically it affects the electrolyte and fluid balance. Okay, it is number one, it is an autoimmune disease, organ specific, which is circulating autoantibodies. Due to TB function, adrenal destruction is very rare, but it can be secondary to HIV. Okay, melanotic pigmentation of oral mucosa include buccal mucosa, gingiva, and palate. Means you have a pigmentation in number one. Then mechanism of pigmentation is not clearly known. Melanin stimulating hormone is secreting by the pituitary gland. Okay, the actual onset of pigmentation may be associated with the variable adrenocortical steroid trophic hormone. Okay, means it is due to the adrenocorticotropic hormone and oral candices. So you have basically pigmentation, melanotic pigmentation in the oral cavity, and you have oral candices basically in this. Investigation is simply you have to do melanotic pigmentation. If it is so, it is due to Addison's disease simply. And basically it is due to the impaired adrenal response to a specific analog of the ACTH. Okay, you can do also cyanatin test, in which you will check your sodium levels number one, and your potassium levels. So okay, so sodium levels are decreased and potassium is increased in the Addison's disease. Okay, then measurement of plasma cortisol, so it will also decrease. You check your plasma level also. Your ACTH will be increased actually. Check your BP is also a decrease because there is a decrease of the sodium. Okay, so check your sodium, potassium, plasma cortisol levels, ACTH levels. Also check your blood pressure. Cushing syndrome is basically due to when there is an increased production of corticosteroids. Okay, or there is an increased function of adrenal cortex. Okay, now basically it is because when a patient is for very long on a very long therapy of the corticosteroids, so it affects their physiological effects similar to the Cushing syndrome. Obesity of the trunk and face, which is main, bruisability, hematoma after the nerve puncture. Okay, hematoma can occur. Erotism, which I have told you, due to corticosteroids. Headache can also come due to. And basically there is obesity of a trunk or moon face, you can say. Okay, remember it. Now we have comes to thyroid function, thyroid diseases. Hyperthyroidism is basically, excessive production of thyroid hormone. Okay, but there is no direct effect on oral mucosa. Okay, exophthalmos of the means there is an bulging out of eye, weight loss, tremors, and you have also tachycardia in this patient. Treatment is carbamazole, which is used as a radioactive iodine. You will give partial thyroidectomy, rarely required unless thyroid causing some compression or compression symptoms. So hyper there is no actually effect. Either it will be like exophthalmos or weight loss, tremors, or basically you have tachycardia in this. So give an radioactive iodine in the form of the carbimazole, and really we do thyroidectomy, remove the thyroid means. Hypothyroidism, which is very important, it is also an autoimmune. Remember it. Excessive removal of the excessive removal of thyroid gland to treat the hyperthyroidism. Sometimes what we do, we remove excessive thyroid gland. Due to it acquired hypothyroidism or myxedema. Okay, what is it? Is a weight gain. inability to tolerate cold, means it gives you an insulating effect. When there is no thyroid, so how will you get insulation? You have dry skin, again loss of hair. Okay, then you will have a slowing down of activity of okay, mental processes. Okay, so weight gain will be here. There will be more cold, there will be a dry skin and loss of hair, affect your mental ability also. Okay, it also affects your immune system also. Patient has also candidiasis because there's a weak immune system now. Also it is related to pernicious anemia. Okay, it is possible also in your family. Congenital hypothyroidism means cret- cretinism, which is characterized by dwarfism or mental retardation in the basically in childhood, when patient is passing through the cretinism congenitally. Okay, remember it. Enlarged tongue, defective facial development, and delayed eruption of teeth, because in this patient everything will be delayed. Okay, immune system is weak, delayed eruption of teeth, facial development will be defected, cretinism means short heighted, mental retardation, enlarged teeth, dry skin, and basically loss of hair, weight gain. Okay, you will see in this patient. So another is diabetes, which is also a common endocrine disorder as a result of deficiency of insulin or resistance to insulin. You have two type of diabetes. We know there is type 1 and type 2. Type 1 is insulin dependent, which is actually from the childhood to the patient. So we know this is the juvenile onset, and type 2 is after their 40s maturity onset of diabetes. Oral manifestation is basically poor oral hygiene patient will have, which is more prone to the periodontal diseases. It also shows a fulminating periodontitis within the periodontal abscess formation, and hemorrhagic gingival papilla lead to the tooth mobility. Okay, so the patient will have bad oral hygiene, a very bad condition. So it can lead to periodontal diseases like a very worsened periodontitis, and also abscess formation and hemorrhagic gingival papilla, tooth mobility. Okay, gingiva pain with inflammation, pain the gingiva, okay, so there's gingiva and it will be pain with the inflammation, frequent bleeding. Okay, there will be bleeding, and bleeding gingival fluid has more glucose level, favor the growth of. So they are saying that the gingiva has more glucose, so it favors the basically microflora and oral candidiasis. That's why median rhomboid glossitis or burning mouth sensation, dysesthesia. Basically the patient will have dysgeusia, will have enlargement of parotid gland, will have irritated dry mucosal surface, increase the incidence of infection and xerostomia. So in gingiva there is an inflammation, bleeding, and also favors the oral candidiasis and microflora growth. In median rhomboid glossitis, there is a burning mouth syndrome in which the patient has burning sensation, dysesthesia, dysgeusia, and enlargement of parotid gland, irritated dry mucosal surfaces, and also increased incidence of infection and xerostomia.